Greetings, welcome back to ERMP and Beyond, the pulse of clinical medicine. Join the channel as we tackle real-world medical cases, enhance our knowledge, and refine our skills with evidence-based practices. Get ready to unravel today's medical mystery with us. So, without any delay, let's dive into the depths of today's medical case discussion.
A 43-year-old male patient come to an outpatient department with a complaint of yellowish discoloration of eyes, epigastric pain, and easy fatigability of 1 week duration. Investigation shows a positive hepatitis B surface antigen. Which investigation helps confirm acute hepatitis in this patient? A. Hepatitis E antigen. B. Repeat hepatitis B surface antigen. C. IgM antihepatitis B core antigen. D. Antihepatitis B surface antigen antibody. In this 43-year-old male, presenting with symptoms such as yellowish discoloration of the eyes, epigastric pain, and easy fatigability, along with a positive hepatitis B surface antigen test result, we are considering the likelihood of acute hepatitis. To confirm acute hepatitis, further investigations are necessary. The presence of hepatitis B surface antigen indicates that the hepatitis B virus is in the bloodstream, but it does not distinguish between acute and chronic infection. For a more definitive diagnosis, we would look for the presence of IgM antibodies to the hepatitis B core antigen. The detection of IgM antihepatitis B core antigen suggests recent infection, and, therefore, acute hepatitis. Additionally, measuring the levels of hepatitis B virus DNA through polymerase chain reaction can provide quantitative information about the viral load, which is particularly high during the acute phase. It's also important to assess liver function tests, including liver aminotransferases, which are typically elevated in acute hepatitis. In some cases, a liver biopsy may be performed to evaluate the extent of liver damage. However, this is less common due to the invasive nature of the procedure. These tests, combined with the patient's clinical presentation and history, will guide us in confirming the diagnosis of acute hepatitis B and in formulating an appropriate management plan. Let's explore the serologic markers that are pivotal in understanding the infection status and immune response in individuals with hepatitis B virus infection. Let's begin with the hepatitis B surface antigen. When someone tests positive for hepatitis B surface antigen, it indicates an active infection with the hepatitis B virus, which could be either acute case or chronic condition. On the flip side, a negative hepatitis B surface antigen result brings good news, showing no current infection. Now, let's talk about immunity. The hepatitis B surface antibody, or antihepatitis B surface antigen, is what we look for here. A positive antihepatitis B surface antigen result is a strong sign of immunity against hepatitis B, which could be due to a past infection that's been resolved, or thanks to successful vaccination. However, if the test for antihepatitis B surface antigen comes back negative, it means there's no immunity, and the individual remains susceptible to the virus. Moving on to the total hepatitis B core antibody, known as antihepatitis B core antigen, this marker offers us a glimpse into past or ongoing battles with the virus. A positive result here means there's been a previous encounter with hepatitis B, or that the fight is currently on. A negative result, however, indicates a clean slate with no history of infection. Lastly, we have the IgM antibody to hepatitis B core antigen. This one's a bit of a time traveler. It tells us if the infection is a recent event. A positive result here signals a recent, acute infection, while a negative result assures us that there hasn't been a recent encounter with the virus. Now, let's look into the hepatitis B and its serologic patterns. Imagine your body as a battleground, and the hepatitis B virus as the invader. Our immune system, the defender, responds in various ways, which we can detect through specific markers in the blood. Now, when we see a positive hepatitis B surface antigen, anti-hepatitis B core antigen, an IgM anti-hepatitis B core antigen, but a negative anti-hepatitis B surface antigen, it's like an alarm going off. This signals an acute infection, the virus is active, and our immune system is mounting its initial defense. On the other hand, if hepatitis B surface antigen and anti-hepatitis B core antigen remain positive over time, but IgM anti-hepatitis B core antigen fades away and anti-hepatitis B surface antigen stays negative, it's a sign that the battle has become a war of attrition and a chronic infection. The virus has entrenched itself, and the fight is ongoing. But there's good news too. When both hepatitis B surface antigen and anti-hepatitis B core antigen are negative, and anti-hepatitis B surface antigen is positive, it's a victory flag, indicating immunity due to a natural infection. Our body has won the fight and built a fortress of antibodies to protect against future invasions. Similarly, if we've been vaccinated, we'll see a negative hepatitis B surface antigen, an anti-hepatitis B core antigen, but a positive anti-hepatitis B surface antigen. The vaccine has trained our immune system to fortify itself without ever facing the actual enemy. Lastly, a negative hepatitis B surface antigen, a positive anti-HBC, and a negative anti-hepatitis B surface antigen can be puzzling. It's like finding footprints without a trace of the intruder. This could mean a resolved infection, where the virus has been vanquished, or a false alarm, a testing error. It might also hint at a stealthy chronic infection, with the virus lurking in the shadows, or an acute infection on the retreat, with our immune system closing in on victory. Each scenario requires, possibly more tests to truly understand the state of play with hepatitis B. Option A, the hepatitis B surface antigen, is not the best choice for confirming acute hepatitis B in this scenario. Hepatitis B E antigen is associated with the replication of HBV and high levels of infectivity. Its presence indicates that the virus is replicating and the patient is highly infectious. However, it does not distinguish between acute and chronic hepatitis B virus infection. Option B, repeating the hepatitis B surface antigen test, would not provide additional information regarding the acuteness of the infection. Hepatitis B surface antigen is a marker of HBV infection but can be present in both acute and chronic hepatitis B. It becomes detectable 1 to 10 weeks after exposure to hepatitis B virus and can persist in chronic HBV infection. Option C, IgM anti-hepatitis B core antigen, as mentioned earlier, is the correct test to confirm acute hepatitis B. It is the most reliable serologic marker for differentiating between acute and chronic HBV infection during the early phase of the disease. Option D, the anti-hepatitis B surface antigen antibody, is not the correct choice for confirming acute infection. Anti-hepatitis B surface antigen antibodies indicate immunity to hepatitis B, either through recovery from a past infection or through vaccination. The presence of anti-hepatitis B surface antigen antibodies would not be expected in a patient with a new acute HBV infection.
It's been a pleasure sharing insights on today's important topic with you. Your understanding is my top priority, and I trust this session has broadened your knowledge. Don't miss out on future discussions by subscribing. Your feedback is invaluable. Please like, comment, and share your thoughts on how to further enrich your learning experience. Together, let's continue this journey of discovery and improvement. Thank you for engaging with today's content.